A very good afternoon to all the respected doctors. On behalf of Hetero Healthcare, we warmly welcome all the doctors to the today's webinar. The topic of today's webinar is minimum invasive procedure for the mandibular impacted third molar teeth. To shed light on this important topic, we are privileged to have Dr. Vishwaraj Nikam sir with us today. Dr. Vishwaraj Nikam sir is a renowned oral maxillofacial surgeon and associate professor at Rangunwala Dental College, Pune. He is an innovator of the revolutionary MIPMIT technique for impacted third molar surgery, which received copyright from the Government of India in 2019 and is now trademarked in his name. Dr. Vishwaraj Nikam sir is a distinguished educator and authorized lecturer of the Maharashtra State Dental Council. He has trained thousands of dentists across India and internationally, including in Malaysia, Dubai, Singapore, Sri Lanka, and Uzbekistan. He has been honored with several prestigious awards, including the FAMDent Heroic Dentistry Award 2022, and has represented India as a speaker for oral and maxillofacial surgeons across Asian countries. We warmly welcome Dr. Vishwaraj Nikam sir to the webinar, and now I would like to hand over the session to him. One small request to all the doctors that if you have any questions or queries during the webinar, please type them in chat box. Dr. Nikam sir will be happy to answer them at the end of the session. Kindly note that. Now I'm handing over session to the Vishwaraj Nikam sir. Sir, please go ahead.
Thank you for the nice introduction. Good afternoon, all. Audible?
Yes, sir, you are audible.
Yeah. Let us start the session. Today's topic is minimal invasive procedure for mandible impacted third molar tooth, a study to prevent incision and soft tissue handling. Friends, in the medical field, revolution is necessary. Demand of stitchless or minimal invasive procedure increasing day by day in all patches of medical science. So why not in dentistry? If you are you want to go for the any surgery, abdominal surgery, always patient asks the surgeon that how many sutures are there. Is it stitchless or minimal invasive? छोटा ही इंसिजन चाहिए, कम जगह से करना है. This is the demand of the patient. So demand of the stitchless or minimal invasive procedure increasing day by day in all patches of medical science. So why not in dentistry? Since 60-70 years, we are incising the tissue, which is a very delicate tissue of mouth and mucosa, and that has no rest because every day we are talking, every day we are swallowing, every day we are eating, and if there are sutures or something is there inside, so it is very difficult for the patient also. And after the surgical removal of mandibular impacted third molar, uh, the main complications are in the form of swelling, trismus, pain, difficulty in swallowing, and other some problems. So this is a routine procedure in day-to-day practice because impacted third molars increasing day by day because of the food habits and the less development of facial muscles and jaw muscles and even the jaw bones. So this is a very crucial procedure in our day-to-day practice, and always, and this is a right of BDS person also to perform. It's not like only a MDS oral max fac surgeon. So this is a routine procedure in day-to-day practice, but there is a very big fear regarding this. So I am here to remove your fear and minimize the procedure. Uh, what is the main culprit behind the post-operative complications like swellings, trismus, pain after the surgical removal of impacted mandibular third molar? The main culprit is soft tissue handling. So our motto is to minimize the soft tissue handling. When the minimum the soft tissue handling, the swelling, pain, trismus, such complications are very less. I think sometimes there are no any post-operative complications. Patients are viewing like a simple extraction. So our motto is to minimize the impact, minimize the soft tissue handling. So for that, I invented one technique that is a minimal invasive procedure for mandible impacted third molar tooth, a study to prevent incision and soft tissue handling in 2019. Actually, I am practicing since 25 years, but I started inventing this since my first day of my medical career. And after the 17, 18 years experience and thousands of cases of mandible impacted third molar, I started in 2002, and in 2019 I got a copyright for this, and this is worldwide accepted procedure, not only in India, worldwide, and this is for the well-being of human mankind, because this is a win-win situation for patient and doctor both. Less time for the procedure, less post-operative complications, and patients are happy, and even patients are ready to pay more because there's a minimal invasive procedure. This is an ethical and win-win situation for both, right? For this, I got a this technique is now published with MIP MIT. Long form, I already told you, Dr. VH Nikam's technique. Management of impacted mandibular third molar is a very routine procedure, and I don't want to discuss in details the routine procedure like incision of a tissue, reflection of a flap, osteotomy if needed, sectioning of a tooth if needed, or toto removal of tooth, whatever may be, suturing, then suture removal, post-operative follow-up. This is a routine procedure wherever you go, all over the globe. You go to Bangalore, Pune, Mumbai, Kolkata, Hyderabad, Paris, London, everywhere. This is a routine procedure since uh, decades. So I tried to minimize this with MIP MIT, this big procedure, and for that I got a national that I got a copyright from Government of India in 2019, and I have been felicitated by Dr. Christopher Hamele, University of Zurich, Switzerland, for the invention and copyright of MIP MIT. What is the initial protocol? I don't want to discuss because of the time limit. Uh, See, friends, I'm here to guide you. I'm just here to introduce you the new scenario, new invention. In this 1 hour time, it's and surgery is not just listening, just not observation, just not observation of videos or YouTube. It's not like that. Surgery is a feeling of fingers. You must feel with your fingers, then and then only you are able to do this. I'll show you so many cases in this lecture, and there is one line always when we you saw some horror or something, some difficult like experimental things on the TV channels. That is, please don't try this at home. So I am telling you, please don't try this at your clinic until you got a thorough and proper knowledge of this MIP MIT. Okay, so in this initial protocol, we know better that we have to take a distal releasing incision, then clavicular, then anterior border releasing incision, reflection of a flap, then osteotomy, removal of a tooth, and suturing as there in this slide. So, wait, I'll show you the first case. Suppose this is a case in your clinic or worldwide. I'm telling you, in any clinic of the world, and the clinically the tooth is visible only 3 to 4% in the oral cavity, very small, and the x-ray, pre-operative x-ray, is like this. Can you imagine without incision or stitchless surgery for this case? But it's possible with MIP. This is the tooth, like a simple extraction, no incision, no sutures, post-operative radiograph, and patient satisfaction and healing after 7 days. Now, friends, your demand is there definitely, sir. Please tell us what is the procedure, what is this magic. There is no any magic. This is a very routine and very nice mechanico-physiological theory. It's a physics and physiology both in this. So this is very easy. This is a procedure of only 5 to 7 minutes. Patients are happy, win-win situation for patient and doctor. So please try to go with these procedures now, because I am flying every week around the globe. Next day after tomorrow, my lecture is will be on IDA Pimpri Chinchwad branch. Last month I was in Delhi, Raipur, Kolkata, Hyderabad, Mumbai, again Mumbai on 4th and 5th of July, 2 days course. So if you are not learning this, patient will ask you, and that is there a speechless surgery at your clinic of my impacted mandibular third molar? If you are telling no, there is incision, and then the definitely patient will go away. So what is the thing in this? What we do? So I'll explain you what is the main thing behind this. Just a second. Wait, I go somewhere. Huh. See, I'll explain you. In our normal language, layman's language, if you want to remove the impacted third molar, first of all, the motto is you have to remove the resistances. The first resistance is always the adjacent tooth. The first resistance is always the adjacent tooth, because third molar, whatever may be impacted third molar, that maybe mesangular, maybe maybe horizontal, it is digging below the C junction of the adjacent tooth, most of the 50-60% cases. So whenever you try to elevate, definitely there is a resistance from the adjacent tooth. So first of all, you have to remove that adjacent tooth, the tooth impacted tooth, where that tooth is in contact with the second molar, by trimming the contact area of third molar without damaging the second molar. And you have to cut the that resistance first. If you are not confident in your early days, you can use matrix bands. So after removal of this, so many resistances are still there. There is a tissue, there will be a bone, there will be buccal bone, no nothing, there is no any possibility to remove this tooth. But friends, this is very easy. You must remember two things. Two P's are very important during extraction. First P is purchase point, and second P is path of removal. Every tooth is having its own path of removal. You have to study the extraction first in your mind and then apply. Your plan should be like this. There is a one sentence. Always begin with end in the mind. Begin with end in your mind. So your plan should be like that. Now, so what is your plan now after remove the contact point? Then definitely we have to go for the purchase point. But how to take the purchase point? It's very difficult. So what we do, we reflect the tissue, undermine the tissue without taking the incision, and we I do the collar cutting of that bone, and we have to make the purchase point below the tooth, and we have to raise it not distally. The modification is distobuccally. So what happens? Cornucopia happens, tooth crown comes buccally, tooth rotates out its own axis, root goes lingually and downward, and cortical plate expands, and this is a path of river, and this is a cornucopia. What is cornucopia? Cornucopia is like this. Every quarter turn, it becomes wider. It's a physics. And remember, physics is the physiology of nature. This is a cornucopia. Galaxy is a cornucopia. Shell is a cornucopia. Sunflower is a cornucopia. So this is a physics and physiology, and that's why the this is phenomenon is accepted worldwide. This is a proven. It's a nature's law, which because whatever we do with the rules of nature, nature is going to help us. If we are going against, always there are some troubles. See the next case of impacted mandibular third molar. 4-8, tooth is not visible. Always in Japan, Germany, Australia, Mumbai, Kolkata, always we take a blade. No. What we do? This is contact point and purchase point. Purchase point is below the contact point. And this tooth is out, 3 rooted. This is an invasion. Another case, you can see the very minimal invasive, like a simple extraction. Another case, if the second molar is curious distally, no need to take care. Definitely, root canal will be the next option for that. In case of distangular, if you break the contact point, because distangular we always do from the elevation from the distal side. So break the contact point, the surface area is gone now, the resistance is gone, lower part will act as a fulcrum and it will rotate around its own axis, and this is very easy to come because what I my motto is and what my phenomena is always tissue belongs to the patient, bone belongs to the patient. Good surgeon duty is that he has to preserve the things that belongs to the patient. I'm cutting the tooth that has to be extracted, and that is a best product for the patient. This is one of the very minimal invasion. See another case. See the clear margin of this. Why to take incision and why to waste the time of patient and yours also? And why to make a complications? That doctor is a good doctor who gives the minimum treatment and cure the patient. And you must have some ability that you are a surgeon must have the qualities: lion's heart, lady fingers, and eagle's eyes. And eagle's eyes should be on the tip of your fingers. आपकी उंगलियों को आंखें होनी चाहिए, वो आ जाती है कुछ दिनों के बाद. Definitely. This is another case. Now some difficult cases, the huge bulgy roots. Tooth is out. Toto. See the invasion. Another case of one gynecologist, one dentist, a lady dentist. Her husband is a gynecologist, and his case was there. She called me at her place, and this was the case of her husband, who is a gynecologist. The tooth 4-8 is not visible in the oral cavity. So worldwide, the protocol is take a blade and take the incision. But I don't want to take the incision. I don't want that 1.5 hour. I don't want that post-operative complications. If the X-ray is like this, we operate. And see the time required for this. The procedure is started.
It should be below the C junction. That's why it's quite difficult. चला सर गॉड को निकाला. See the conservative approach. No incision, nothing. Everything is perfect. Yeah, with this. With this. See, this is a very conservative approach without any bone cutting, without anything. It's just reflected. Just example. Without any surgery, without any suture. Done. So,
This is a tooth, and this was the invasion just post-operative, and this was the healing after 7 days. And see the patient's experience in Marathi only, no problem. I think you people all are Kolhapur area. You must know the Marathi and just listen to this. This is their clinic. She called me here only, and next day they give their experience.
Dr. Shivraj Khanare, dentist, व माझे मिस्टर डॉक्टर अमोल खनारे, गायनेकोलॉजिस्ट आहेत. आम्ही विठ्ठलला खनारे हॉस्पिटल मॅटर्निटी व डेंटल येथे प्रॅक्टिस करतो. त्यांचा हॉरिझॉन्टल इम्पॅक्टेड टूथ होता. आम्हाला डॉक्टर निकम विश्वराज सरांचे नाव व त्यांचे जगप्रसिद्ध नॉन सर्जिकल टूथ एक्सट्रॅक्शन प्रॅक्टिस बद्दल समजल्यानंतर त्यांच्याकडूनच टूथ एक्सट्रॅक्शन करण्याचे ठरवले. त्याबद्दल त्यांच्याशी कॉन्टॅक्ट करून त्यानं व्हिजिटसाठी रिक्वेस्ट केली व त्यांनी लगेच होकार दिला व आमच्या हॉस्पिटलला आले. त्यांच्याबद्दल माझ्या मिस्टरांचा एक्सपिरियन्स ते शेअर करतात. नमस्कार. माझं तर 1 वर्षापासून ज्यावेळेस एक्सरे काढला त्यावेळेसपासून आम्हाला कळलं की माझा हॉरिझॉन्टल इम्पॅक्टेड टूथ होता. पण ते काढायची भीती वाटत होती कारण ते सूज आणि माझ्या गायनेकोलॉजिकल प्रॅक्टिसची रोज प्रॉब्लेम येणार होता म्हणून. पण ज्यावेळेस निकम सरांचं कळलं आम्हाला की निकम सर नॉन इन्व्हेसिव्ह पद्धतीने नॉन इन्व्हेसिव्ह टेक्निकने व न इन्सिजन घेता बोन लॉस न होता ते टूथ काढतात म्हटल्यावरती एक धीर आला. ज्यावेळेस सर आले त्यावेळेस आता सध्या सगळ्या सर्जिकल ब्रँच मध्ये नॉन इन्व्हेसिव्ह टेक्निक पुढे येते. त्याचप्रमाणे डेंटल सर्जरी मध्ये पण नॉन इन्व्हेसिव्ह पद्धत त्यांनी आणून ते जग प्रसिद्ध म्हणजे वर्ल्ड वाईड ते फेमस होत आहे. त्यानुसार त्यांनी आल्यानंतर मला काउन्सिलिंग करून व्यवस्थित लोकल लोकल अॅनेस्थेशिया दिल्यानंतर काही समजायच्या 3 ते 4 मिनिटांमध्ये न बोन लॉस होता न सुचर घेता त्यांनी माझा दात काढला. त्याबद्दल मला नंतर एक अर्धा पाऊण तास झाल्यानंतर मी लगेचच माझे रुटीन ओपीडी पेशंटची काउन्सिलिंग करायला चालू झालं. आज सेकंड डे आहे टूथ एक्सट्रॅक्शन नंतरचा, तरी पण अजिबात स्वेलिंग नाही, काही नाही. त्याबद्दल आम्ही पूर्ण खनावरे कुटुंबातर्फे निकम सरांचे हार्दिक आभार मानतो व त्यांच्या जे पुढचं रिसर्च आहे हे असंच वर्ल्ड वाईड फेमस व्हावं त्याबद्दल त्यांना शुभेच्छा देतो. थँक्यू.
This is another case. Friends, uh, it seems a very easy procedure when I am performing all these things, but there is a very big study of 20 years over there. So, only on the lecture, don't try the difficult cases like this. Because I'm a speaker worldwide. I visited Ahmedabad, Delhi, Kolkata, Hyderabad, Trivandrum, Pune, Mumbai, Bangalore, Raipur, Jaipur, Srinagar. So people are crazy for this and they want to try all these things. But first of all, thorough it nicely. Call me. Feel free to contact me. Ask me. There are so many tricks, hidden tricks behind this. Around 25 to 40. It's not possible on online or something, but definitely I'm ready to tell because I don't want to hide anything because this is a very revolutionary technique and this is for the well-being of society also. Okay, now next case. It is there. So prior you learn this properly, call me anytime, then perform. Only this is a 1 hour lecture and you are going to perform very easy procedure like that. It's not possible. Mandibular fracture incidences are very more if you are doing directly without any study. This is another case. J hook. See the tooth. Ganpati Bappa Moria. Very nicely removed. J hook very easily. See the invasion. Where to suture? Tell me where to suture and why to suture. To show the patient that we perform for 1.5 years, so please pay me 5,000. No need. If you are removing like this, you can get 8 to 10,000 in 10 minutes ethically, without hiding and without lying the patient. If the abdominal surgery is Open abdomen surgery is for 50,000. Then the scopy is for 90,000. Tell them if you have to open the tooth, take the incision. 5,000 are my charges. If you don't want to open and you want with one new procedure and within 10 minutes without any complications tomorrow, so it need 8 to 10,000. Patients are ready to pay. Only they will ask you, please do it for in 7,000 or something. No problem. In 10 minutes. This is another case. See the procedure start to end. Tooth is not visible in the oral cavity. This is our Bhavani Talwar, my favorite instrument in the field of oral maxillofacial surgery. Old is gold. There are so many fancy instruments nowadays of no use. They are bending within 2 days.
See the tooth? I am creating the purchase point.
The purchase point is very important. Tooth is not visible in the oral. It doesn't mean that you have to take the incision and take the blade in your hand. Why?
See the tooth is coming out.
See my struggle.
Very good. Just dear cooperate me for 5 minutes.
Like
please.
a gynecologist for the normal delivery.
This is without incision, with minimal invasion. See.
Tell me where to suture and why to suture. Where to suture this and why? Is there any possibility of big swelling and trismus and something? No. From the next evening only, patient is eating everything absolutely normal, and she paid 10,000 for this for 5 minutes. This is a time now to change, not only to show the patient that we are performing very big procedure. No, patient want result. This is another case. 3.8, it is not visible in the oral cavity, and this is a chubby cheek of that patient. Even the erupted third molar is there. We have to search for the erupted third molar, because on the occlusal table, whenever patient open the mouth, the patient's occlusal table is full of fats, and the x-ray is like this. Again, I am showing this is the case, clinically presentation, chubby cheeks, and horizontal tooth, and tooth is out. Post-operative extract, radio after this, and after surgery, and this is post-operative photograph with minimal invasion within 10 to 12 minutes. Another case, J-hook, horizontal, tooth is out, like a simple extraction. See the patient satisfaction behind this. Another case, everywhere in the world, every surgeon will open this, and within 5 minutes tooth is like this. See the invasion, where to suture and why to suture. Friends, believe me, now today's era is of minimal invasive procedure. If you don't want to learn, don't learn, but patient will ask you within 2 to 3 years. बिना टाक्याची अक्कलदाड तुमच्याकडे निघते का? तुम्ही नाही बोललात तर पेशंट म्हणेल मी परत येतो. showing you so many cases. See the experience of this girl after the surgical removal of the MIP MIT.
It was awesome. It was best.
There is a cotton in the mouth.
And fantastic. My words are less to say. It was good. I was nervous before, but then when he started working, it was very good. I felt nothing at all. Right from the beginning till the end, was great.
Thank you very
And it was so quick. I'm not finished. It was so quick, and I don't believe that I've finally removed it without any suture or without any surgery. It is such a satisfaction. It was so conservative and great.
Thank you very much. Thanks a lot. Thanks a lot.
You're welcome.
So now suturing techniques. Go for. This is another case. See the tooth below the C junction, pressing the second molar, and see the tooth is out like this. And this was the invasion, and very bloodless field, because that area is very small. There is a blood during the surgery of third molar, blood, saliva, tongue, elevator, suction, flap, everything in that area. So it's very difficult. So why to raise the flap? No need. These are my favorite instruments. First, we call as a Bhavani Talwar, that is London hospital pattern, and second is a Cox valve, that is a Bhala. This is my team. Every month it's changing. This is 4-8. See the root pattern. Huge bulgy roots. See, tooth is out. See the invasion. Now these are some cases. Because see friends, I conduct courses worldwide. There are some 2 days courses of oral and maxillofacial surgery total, with including minor surgeries and all the protocols. And this mostly the MIP MIT, only the demos, live demos, and all over the world, in Dubai, Kolkata, Sri Lanka, Bangalore, Hyderabad, everywhere. And even I conduct courses for in-house courses at my place at Fulton and Pune. Uh, Only 3 people per batch for 1 month, and actual hand to hand, actual the surgical experience with their own hand. So these are some cases performed by that doctors, that my students, that students are also very big. Sometimes they are practitioners, good, very well-known practitioners, and practitioners of 20, 25 years old. They closed their the last month only. One doctor came from Dr. Gupta sir came from the Chandigarh, and they learned this. Even my dear good friend of recent president of IDA Mumbai branch, Dr. Rohit sir, also here with me for the in-house course. Learning never ends. Even I am learning. You people are learning like that. I am also learning. No one is perfect in this medical science. See, this is a tooth which is impacted, and we are going to remove. This is not visible in the oral cavity. Absolutely not visible. Now, after I have injected already the local anesthesia, now the procedure is started. See, this is MIP MIT Dr. Vishwaraj Nikam's technique, in which I'll show you just a second what happened. Wait, wait. I'll just. The tooth tip should be visible here. Because of time limit, I have to show you what happened. Uh,
This is a tooth which is impacted
this is broken
and
after during my
this
MIP
is not
MIT, and I want
visible
to
in the
show
oral
you
cavity. Absolutely
what to
not
do for
visible.
such cases.
Now, after irrigate suction, now again, I'm trying to elevate this tooth.
See the bloodless field. The point to be noted. Bloodless. There is a magic behind the bloodless field.
It's a very tough bone over there, I think.
See my struggle. And now the crown is broken.
Yes,
Still,
the crown is broken over there slightly.
still I'm not going to
It's
open.
okay. Till I'm not going to open. No incision.
It's a live surgery.
Now the crown is broken. Broken. It's okay. I'm making the purchase one again.
I told you for prior only, purchase point is very important.
Start.
If you're playing for 1 hour, why? Only purchase point and path of removal is these two P's. Try to understand these two.
Why to incise the tooth? Minimal invasive procedure this is. Still the crown is broken. I'm not incising, I'm trying my level best. And see, magically, come here. Don't go there. Come here. See, magically, this tooth is coming out. Is out. See, do that please. MIP Dr. Vishwaraj Nikam's technique. The tooth is the crown is broken because there was a carious crown. And see, after that also, I have not incised the tissue. This is the minimal invasion of this procedure. Like a
And
simple
patient want this
extraction.
result.
Again, see this the broken tooth with Toto. Ma'am, you're happy? Your work is done. Very nice, thank you. And this is very small procedure because again I'm telling to you all surgeons of the world, if I am, if I am, come with me. If I am incising the tissue, it belongs to the patient. If I am cutting the tooth, it belongs to the patient. Good surgeon duties that he has.
Always you have to preserve the
and I am
tooth,
getting the bone that
preserve the bone and
that is
tissue.
best for the patient. Thank you very much.
मेरा नाम अमृता सालुंगे है। मैं स्पेशली डॉक्टर निकम सर के पास पुणे से आई हूँ, ऑल द वे ट्रैवल करके। मैं दूसरे डॉक्टर के पास जाके कंसल्ट किया था, बट उन्होंने मुझे स्टिचेस लगाने पड़ेंगे एंड 1-1.5 घंटे कॉम्पिटिशन बोला था। बट मेरे हस्बैंड का टूथ अक्कल दैट इन्होंने ही निकाला था, दैट इज विदाउट एनी स्टिचेस। विद इन 3 to 4 minutes डॉक्टर निकम ने मेरा अक्कल दैट निकाला। उसके ऊपर पूरा स्किन था, वो तो अक्कल दैट दिख भी नहीं रहा था। उन्होंने एकदम पेनलेस और सर्जरी किया है आगू से एंड एकदम मतलब मुझे कोई पेन नहीं हुआ है, कुछ भी नहीं हुआ है। और पूरी दुनिया में ये एक में डॉक्टर ऐसे हैं जो अक्कल दाढ़ प्रॉपर्ली निकाल के देते हैं, दैट टू विदाउट एनी स्टिचेस। यू कैन सी पहले ऐसे थे वरना, और अभी विदाउट एनी पेन उन्होंने निकाल के दिया है। अभी मेरा ये साइड का निकालना है, मैं सेकेंड टाइम फिर से आऊंगी ये साइड में निकालने के लिए। एंड आई वुड रिकमेंड कि आप कोई भी डॉक्टर से जाने से पहले इनके यहाँ प्लीज आना, बिकॉज ये आई वुड से फॉर मी इज द वर्ल्ड्स बेस्ट डॉक्टर, वर्ल्ड्स बेस्ट डेंटिस्ट आई वुड से. थैंक यू डॉक्टर, थैंक यू सो मच.
Now this is my team. Every month is changing. Every month, three people all the globe, from Dubai, Kolkata, Hyderabad. Even next to next month, the people register from Australia, Adelaide.
ओरल सर्जरी हा विषय मी बोललो होतो की खरंच शिकवला जात नाही. ज्या लेवलला आपण कॉलेज सोडलं ना त्यावेळेस जे ओरल सर्जरीचं नॉलेज होतं तेवढंच नॉलेज होतं. आज मलाही 20 वर्ष झाले.
This is a work course at Chhatrapati Sambhaji Nagar for 2 days course.
तर ओरल सर्जरीचं नॉलेज तिथपर्यंतच होतं. आणि प्रत्येकाच्या आयुष्यात काहीतरी घटना घडल्या ओरल सर्जरीच्या बाबतीत ज्याच्यानी एक ट्रॉमा बसला आणि तिथून पुढे ओरल सर्जरीची भीती निर्माण झाली असते आणि म्हणून ओरल सर्जरीचं काम माणूस कमी करतो. कारण डेंटिस्ट्री इज इक्वल टू ओरल सर्जरी. आपल्या गावाकडे काय माहिती लोकांना दाताच दवाखाना म्हटलं तर दुसरं लोक म्हणत नाही रूट कॅनल करायचं, दात काढायचं हेच म्हणतात. सो डेंटिस्ट्री इज इक्वल टू ओरल सर्जरी. आणि ती खूप डिफिकल्ट होती असं सगळं वाटायचं. ते शिकवणारा कुणीच भेटलं नाही ऑनेस्टली. पहिल्यांदा तुमच्या रूपाने आम्हाला खरोखर सगळ्यांच्या वतीनं मी सांगतो सर देवासारखी आला. आणि तुम्ही ज्या प्रकारे दिलंय ना म्हणजे एक तुम्ही तरी म्हटलं हातचा काय मी 0.1 मिलीमीटर सुद्धा तुम्ही न राखता सगळं दिलं. खूप मोठ्या मनाने दिलं. कारण सर्जन कधीही स्वतःच स्किल सांगत नाही. मी जेवढे ओरल सर्जन बघितले माझ्याकडे बरेच लोक व्हिजिटिंग येऊन गेले. शिकवण्याची वृत्ती कुणाचीही नसते आणि ही तुमच्यामध्ये दिसली. हे खूप खूप मोठं ग्रॅटिट्यूड सर. आणि तुमच्या बरोबरीनच ही सगळी टीम. कारण
These are some cases when people come for the in-house course at my place. The girl from I think Mumbai, I am not I don't remember exactly, but maybe this group is from Mumbai, and she independently performed this after learning, not only with this lecture. Please, again, I'm telling you, you are just listening to this lecture and trying. Don't do like this. Learn, study it properly. Ask me, and then definitely go. I'll support you. Even you're not coming to my course, next course, nothing. No, it doesn't happen. I'm an ethical person. I'll guide you as a colleague, definitely. But ask me first, because this invention is very not a simple invention. This is a revolution in the field of oral and maxillofacial surgery. And I think in coming days, within 2 3 months, I'm physically coming to IDA Kolhapur branch for the lecture, because my wife is from Kolhapur. So I would love to come to Kolhapur, and we'll plan soon. So that learning is very different if I am in front of there physically. Right, I'll tell you more tips and tricks behind this. And this is another course by this girl, another case by this. The girl is from Bid or Jalna somewhere. I didn't remember, but something like that. Another case independently done by the students. See the horizontal tooth at very lower border, and see the invasion. The girl, maximum the weight of this girl is 38, I think. And still, she is remembering. She is remembering the tooth, inverted tooth. आई टोल्ड यू, हर बार दांत निकालने के लिए ताकत की जरूरत नहीं होती. कुश्ती में हर बार, कुश्ती तो पता है कोल्हापुर वासियों को, हर बार ताकत की जरूरत नहीं होती. उसमें डाव होते हैं, वैसे भी एक्सट्रैक्शन में डाव होते हैं. So there are some tips and tricks during extraction. See the another case. See the pattern of root and happy patient. Within 5 minutes, patients, and they are paying us 7 to 8,000. The girls from Bhuvaneshwar. Definitely, I remember these girls from Bhuvaneshwar, Odisha. They came long the way to Fulton to learn. This is another case. Sirif, see the truth. This girl is from Abu Dhabi, Dubai. Came long the way to Fulton for this 1 month course. And now she is in Debrecen and performing very nice teaching MIT. Even on the case paper of Debrecen, in the Debrecen, she was writing, done by MIT Dr. VH Nikam Stagnek. See another case. Very nicely done by this girl. See the happiness on her face. See the patient's happiness. And definitely my even I'm very happy with this. And where to suture now? Tell me. And why to suture? And why to waste one hour in this? See the root pattern. And imagine this is the magic of cornucopia. Nature is great. See the another case. See the invasion, like a simple extraction. Another case. These girls are from DY Patil, Mumbai. I remember these girls. 2.5 years back, I think so. See the patient's confidence also. The girl from Indore, Madhya Pradesh. That girl is from Siliguri also. Siliguri. This is another case of impacted mandibular third molar, which is inverted. See the lower border of mandible, the possibility of fracture, of pathological fracture or fracture during the surgery, removal of third molar. And definitely if fracture happens, you must go for that recon plate. But with MIT fracture, no possibility of fracture. Even there is very less possibility of dislodgement of tooth into the lingual pouch. See the healing after some days and everything is absolutely normal. This girl is from Siliguri, yes, West Bengal. And this is the learning one-to-one. Actual work on patient, not observation. Another case. Done by this girl in 1 month course. Very nice. सगळं दाखवायचं ते पण दाखवायचं.
Very good. Dr. Shruti, I'm very happy today independently you have done case. Show the case like this. Case like this. Finger. Just show me. Show the invasion. It's like a simple extraction.
See the bloodless field, the magic of
Very
bloodless field.
nicely done. Very nicely done by Dr. Shruti. And this was the case. You have done very nicely. And I'm very happy. The best, the best, the best. Good.
Another case by same girl. And now she's visiting in her city as an expert in MIT, third molar. See the case, see the invasion, see the case. It's not very easy case. See the X-ray. And see the invasion of the post-operative. This is win-win situation for patient and doctor both. Why you are incising? My question is there. Why you always incise and waste your time and patient's time? This is my question for all surgeons. Not only Indians, the lady from Switzerland came to my Pune's clinic for the removal of impacted third molar stitchless. This girl is from UK. Bilateral. See the bilateral. Same time. These foreigners are very delicate. And same time bilateral I done at Koregaon Park, Pune. I remember this case. At my very good friend Dr. Mansi Jadav's clinic. This is one of the beautiful clinic in Koregaon Park.
It's like a simple extraction. Very nice. Nicely completed by so nicely. And your one work is over. Good, 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 good. You're happy? Thank you, thank you. And now tell your US people, your friends, come to India for the speechless and penless extraction. Yeah. Thank
I introduced first time last 10 minutes are left. I have to forward something. I first time introduced in Nasik in Maharashtra State Dental Conference, then Idea Karar, and so many Idea branches. I just put some photographs. This is my course, in-house course. Zonal Conference, Amravati. National, first time launch in National Conference at Kerala in 2020. This was my national lecture, first time. And see the response of this MIPM at Delhi.
Sometimes what happens, 8 is there, 7 is missing, and 6 is present. How do you do it? So take an angle like this.
I got an award at Tiruvananthapuram, Kerala for this. First time international launch at Tashkent, Uzbekistan. First time at Association of Oral and Maxillofacial Surgeons of India, Maharashtra Conference, State Conference. First time at Association of Oral Maxillofacial Surgeons of India at National Conference, Indore, only oral surgeons conference at national level. Asian Congress of Oral and Maxillofacial Surgeons of all over the world, 42 countries, oral surgeons. Live demo at Ahmedabad Dental College. Ahmedabad Dental College. Raipur. Every alternate 2 months, I used to go to Raipur. Wait, what happened? Every time 2 days course of 20 people. This is my 7th course in Raipur at 18th and 19th of July. I teach cosmetology also, some polytrauma. I don't want to discuss such cases because this is the time is limit now. Last 2-3 minutes, I'll finish. This is my copyright at my award at Kollam, Trivandrum, appreciated by World Dental Federation, Famden Pune, Famden Heroic Dentistry Award of the Year 2022, Famden Award 2023. This is a very big award in Mumbai.
It goes to Dr. Vishwaraj Nikam. Yes,
These are the very big shots of Mumbai.
He has developed a new technique for third molar. Yes. Impacted teeth, which is almost non-invasive, I would say, but it's minimally invasive, and that prevents any sort of discomfort for the patient as well. Congratulations. He has a copyright on it. In fact, at the last fabric show, this was the last lecture, but it was an earth-shaking lecture because he shared technique of extracting third molars without using forceps.
I got a prize at Hotel Taj, Mumbai. And the main thing is appreciated by Dr. Stanley Malamet, sir. This is my copyright. And now this will be in the textbook of oral maxillofacial surgery with MIP amateur Dr. VH Nikam's technique. Apart from dentistry, I have some hobbies. I played a role of Chhatrapati Shivaji Maharaj and Chhatrapati Sambhaji Maharaj so many times. Take the photograph of this and feel free to contact me anytime. Even you are not attending my course further in my life, please, as a colleague, I am an ethical person. Ask me, I'll support you, I'll definitely guide you for this technique. And join my YouTube channel, which is very new now, but join it, Dr. Vishwaraj Nikam YouTube channel. Yeah. This sentence is very important in life as well as in surgery. The perpetual preservation of what remains is most important than the meticulous replacement of what is lost. Devon's principle. Apart from this, a post-operative care is also very important. Your prescription and even after surgical procedure, gargles are very important. Warm sunlight gargles or Hexam mouthwash I'm using since 1 year. It's a very nice product because it is having a hyaluronic, chlorhexidine gluconate and hyaluronic acid combination. So no staining problem. Even it's a very effective for the infections, post-operative infections. I definitely recommend this, which is very easily available now. And the one more thing is not a big bottle, only 10 ml packing is also there. So please note this mouthwash is also very good. And antibiotics, always we prescribe amoxicillin and clonic acid combination, which is very useful. And mpxcv 625, this is a routine by prescription since so many days, because this the possibility of hyperacidity problems are there. This is very beneficial in such conditions. No hyperacidity, and even the gastric flora, it takes the care of gastric flora. No need to give some another medicines, because sometimes dysentery problems are there after antibiotics. So this tablet is taking care of this, and I definitely uh, prefer this. And thank you very much. Thank you for the organizers for such a nice arrangement and sessions. Thank you, Kolhapurkar, and I'm always with you. And I'm trying to come to Kolhapur IDA as early as possible for the lecture. Thank you.
Thank you so much, Dr. Vishwaraj Nikam sir, for this insightful session and sharing your expertise on MI PMIT techniques, sir. So we also thank you all the doctors for joining today's webinar, and thank you all of you for your valuable time. So thank you so much. So we are winding up here, sir.
Thank you. Thank you.
Thank you, sir.